Are you struggling to understand ventricular fibrillation? Then guess what? This video is for you. Hi, I am the nurse Dr. Asia, and this channel is dedicated to helping you, yes, you, pass nursing school. So guess what? Don't gatekeep this information. Share it with your class so you all can pass nursing school together. Let's get started. So first I want to go over a EKG wave to let you know how it's supposed to look and what it actually means. So our P wave shows atrial depolarization. So that means that the atrium contracts, and when the atrium contracts, it then pushes the blood to the ventricles. All right, so then we have our QR complex, and that shows ventricle depolarization. So that's when the ventricles are contracting, and once the ventricles contract, it pushes blood to your lungs and your body. Then you have your ST segment, and this is a pause between contraction and recovery. The heart muscle is starting to recover right here. And then your T wave shows ventricular repolarization, and this is where the ventricles are resetting and getting ready for the next beat. So before we go into abnormalities, we need to know what it should look like and what is the role of each thing, whether it be the P wave, the QRS, or the T wave, or the ST segment. So let's talk about ventricular fibrillation. Let's look at the name to start with it, ventricular. So that lets us know that the problem is within the ventricles. So what is the purpose, or what is the job of the ventricles? So the job of the ventricles is to receive the blood from the atria, and then it contracts and then sends out the blood to the body and the lungs, okay? So the definition of ventricular fibrillation is it is a life-threatening, chaotic rhythm where the ventricles are quivering instead of contracting. So our ventricles are doing like this. They are shaking, but they are not contracting. So we know that we need our ventricles to contract in order to send out the blood to the rest of the body and the lungs. So with this patient, they have no effective cardiac output. So that patient will have no pulse. They will have no perfusion. They will have no blood pressure. Why? Because the ventricles need to contract in order to push out that blood to the lungs and the rest of the body. So this is a cardiac arrest rhythm that requires immediate action, you guys. So once you see ventricular fibrillation on your monitor, it is time to act ASAP. So how do you recognize VFib on the monitor? So as you can see, it is totally disorganized electrical activity, right? You see no P waves, you see no QR complexes, and you see no T waves. Why? Why are we not seeing these things? Because we are not getting any cardiac output because the ventricles are not contracting. So you're not going to see any QRS or T waves. We're not going to see any of that stuff. It's going to be irregular. You can go to see it could be wavy. It will be wavy, and it's going to be a chaotic baseline. And the patient is going to be unresponsive and pulseless. Think about it. If a patient is in VFib, they have no cardiac output. So how are they going to be living without cardiac output? So that is why it is important to recognize this, you guys. And it is important to recognize this ASAP. So what are some causes that could lead to a patient going into VFib? You want to think H's and T's. So it could be caused from hypoxia, hypovolemia, hypothermia, hypokalemia, hyperkalemia, also acidosis. Our T's, which could be a tension pneumothorax, cardiac tamponade, toxins, or a patient having an MI or a PE or any type of trauma, okay? This slide is the most important slide of the video. So what to do if you see on the monitor that your patient is in ventricular fibrillation. So first you want to do is you want to assess your patient. So you guys, we're never going to just believe the monitor, right? We want to make sure that we go and assess our patient. And if our patient is unresponsive and pulseless, we want to call a code. So remember, the patient's ventricles is not contracting, so the patient will have no cardiac output. So after we call that code, we want to start CPR immediately. And once the people bring the AED, your coworkers or whatever, bring the AED, we then want to defibrillate the patient as soon as possible. So defibrillate means to shock the patient. So for VFib, we have to defibrillate that patient. And defibrillation is the only treatment that can restart the heart if a patient is in ventricular fibrillation. So our priority is going to be defibrillation. But we're going to do CPR until our AED gets there. So I wanted to insert a picture for the visual learners. So what I love about this one is it actually has the paddle on there, and it has like the actual pads. So it depends on what your facility has, if they're going to actually defibrillate the patient with the actual paddles, or they're just going to defibrillate the patient with the actual pads. All right. So let's talk about some medications that can be used in VFib. So we have epinephrine. So epinephrine, that can be used to improve the perfusion to the heart and the brain. We could give amiodarone, that helps stop VFib if the shocks don't work. And then you also have lidocaine, which is another antiarrhythmic if amiodarone is unavailable, you guys. So this is the medications that can be used. I'm going to say it again. VFibs equals CPR plus defib. But the priority is going to be defibrillation. We have to shock that patient's heart in order to get the heart back working. So you've learned a lot. Now let's do some NCLEX questions. A nurse is caring for a client who develops ventricular fibrillation rhythm. The patient is unresponsive, pulseless, and apneic. Which of the following actions is priority? Is it 1, defibrillation, 2, airway management, 3, epinephrine administration, or 4, amiodarone administration? So I'm going to give you some time to think about it. If you chose 1, defibrillation, then you are correct. You guys, remember that with ventricular fibrillation, you have to shock the patient. So, did anyone choose airway management? Okay, because you're thinking ABCs, right? But no, when a patient is in ventricular fibrillation, there is no point of giving them oxygen if they are unresponsive and without a pulse and their heart is not working. We have to restore cardiac rhythm before we do anything, and we have to do that by doing defibrillation. A patient is found unresponsive and pulseless. The cardiac monitor shows ventricular fibrillation. What is the priority nursing action? Is it A, administer amiodarone IV, B, begin high-quality CPR, C, prepare for synchronized cardioversion, or D, administer oxygen via a non-rebreather mask? So, I'm going to give you some time to think about it. If you chose B, begin high-quality chest compressions, then you are correct. So remember, if you do not see defibrillation as an option, you're going to do CPR until the AED gets there, and then you can do defibrillation. So you're just like, Nurse Doc Tudor, I thought you said that defibrillation is priority. Defibrillation is priority. But how about if you don't have a AED near? You will have to do CPR until the AED gets there. A patient remains in ventricular tachycardia after 2 defibrillation attempts and ongoing CPR. Which medication should the nurse anticipate administering next? Is it A, atropine 0.5 mg IV, B, amiodarone 300 mg IV push, C, adenosine 6 mg rapid IV push, or D, Ditazam 10 milligrams IV push. So if you chose B, amiodarone 300 mg's IV push, then you are correct. So remember, we're going to give that anti-arrhythmic medication to try to put us in a normal rhythm or restore rhythm in this patient after they have been shocked 2 times and have been ongoing CPR. And just like that, the lesson is over with. So I hope that you have learned a lot from this video. So share it with your classmates, and I will see you guys in the next lesson. Thanks for watching.